Welcome to the deep dive. Ever had that weird thing where your finger or maybe your thumb just catches or locks up when you try to move it?
Yeah, that clicking or locking feeling.
Exactly. Well, today we're getting into trigger finger. The technical term is stenosing tenosynovitis. We're using some revision notes to keep it focused.
Right. So the plan is a quick, clear rundown, what it is, why it happens, and what the options are.
Perfect. So let's start with that basic idea again. It's like a tunnel problem.
Kinda, yeah. Think of your tendons as ropes sliding through tunnels, the tendon sheaths. They have little loops, pulleys guiding them.
Okay.
With trigger finger, there's a size mismatch. Either the rope, the tendon gets thicker, or the tunnel entrance, the pulley area, narrows.
Ah, so it snags.
Precisely.
Hmm.
That size disparity is what causes the friction, the catching, the snapping. That's the key mechanical issue.
Got it. So, definition-wise, we're talking inflammation, narrowing of that sheath,
hmm
making it tough for the tendon to just glide smoothly, leads to difficulty bending, straightening, maybe that full lockup.
You've nailed it. That's trigger finger in a nutshell. So what actually causes that thickening or narrowing?
Well, the notes say primarily it is that thickening of the tendon or the sheath itself. That's the direct cause.
Right. But they're often contributing factors, things that make it more likely.
Yeah, like repetitive hand movements are mentioned, and past hand injuries.
Also, conditions like diabetes, rheumatoid arthritis, those seem to increase the risk. And sometimes it's just down to someone's individual anatomy, slight variations.
Okay, so risk factors overlap a bit there.
Yeah.
Repetitive actions, constantly putting pressure on the palm,
Yep.
being female, getting older, those are listed too. And again, diabetes and rheumatoid arthritis pop up. So several things to be aware of.
Absolutely. It helps build a picture. Now, how does that thickening actually cause the trigger, the pathophysiology?
Right, the mechanics.
So that inflammation or thickening creates a sort of lump or nodule on the tendon.
Like a little speed bump. I like that analogy.
Exactly. A speed bump on the tendon. So when you try and bend or straighten your finger, that bump catches on the edge of the pulley, the tunnel entrance.
And that's the click or the pop?
That's the click, the pop, or sometimes it just gets stuck, it locks.
Makes sense. But, okay, if you have these symptoms, clicking, locking, could it be something else? We shouldn't just assume trigger finger.
Good point. Always important to consider other possibilities, the differential diagnosis.
Like what?
Well, general arthritis in the finger joint could cause pain and stiffness. Other types of tendonitis, maybe. Dupuytren's contracture is another one that affects the palm tissue, causing fingers to curl.
Oh, yeah, that's different.
And maybe even something like a ganglion cyst near the tendon sheath could potentially interfere.
Right.
So yeah, need to rule those out.
Right. And how common is this in the UK? Do we know?
The notes give an estimate maybe around 2 to 3% of the general population.
So not incredibly rare.
No, reasonably common. And as we mentioned, it does seem to affect women more often than men. And it's more common in people over, say, 40.
Okay. So let's talk symptoms. What does it actually feel like day to day if you have it?
Typically, pain and tenderness right at the base of the finger or thumb on the palm side.
Where that pulley is.
Exactly. Stiffness is the big one, often worse in the morning. Then there's the main event. Difficulty bending or straightening, often with that very distinct pop or click.
The trigger.
The trigger, yeah. And in some cases, it actually locks in a bent position. And you might have to physically use your other hand to straighten it out.
Wow. Okay. And it's usually thumb, middle, or ring finger.
Those are the most common culprits, yes. And sometimes you can actually feel a little lump, that nodule we talked about, at the base of the finger.
Feeling the lump, that's quite specific. So how does a doctor confirm it? Are there scans involved? Blood tests?
Usually, no. It's interesting. Diagnosis is mainly clinical, based on what you tell the doctor your symptoms and what they find when they examine your hand.
So they'll watch you move your finger.
Yeah, they'll check the movement, feel for that nodule, try to reproduce that catching or clicking. It's often pretty clear from the examination.
And scans like ultrasound or MRI?
Generally reserved for atypical cases, maybe if they suspect something else is going on or if the picture isn't quite classic trigger finger, but usually not needed for diagnosis.
Okay, so mostly a clinical diagnosis. Makes sense. What about managing it then? What are the treatment options, say, in the UK?
There's a spectrum. Often starts with non-surgical stuff.
Yeah.
Simple things like resting the hand, avoiding activities that aggravate it. Ice can help sometimes.
Splinting, maybe?
Yes, splinting, especially at night to keep the fingers straight, can be useful. Specific hand exercises might be suggested. And over-the-counter anti-inflammatories like ibuprofen can help with pain and swelling.
What about injections? I've heard about those.
Yes. Corticosteroid injections, they're injected right into the tendon sheath near the pulley. They're often very effective at reducing the inflammation and swelling, allowing the tendon to glide again, often gives significant relief.
And if that doesn't work or it keeps coming back?
Then surgery becomes an option. It's usually a minor procedure, often done under local anesthetic, where they release that tight section of the pulley, the A1 pulley, giving the tendon more space to move.
Sounds pretty definitive.
It usually is, yeah. And it's interesting, the notes mention that point about repetitive use. Again, while it's seen as a risk factor, the direct causal link isn't always super strong in evidence terms. Something to keep in mind.
Right. So overall, what's the outlook? Is it something that usually gets better? The prognosis?
Generally, yes, the prognosis is good. Most people find relief with those conservative measures or injections. Improvement often happens within weeks to months.
That's encouraging.
It is.
Yeah.
But it can come back, especially if the underlying factors like repetitive strain continue. Recurrence is possible.
And what if you just ignored it? Are there serious complications?
Complications are rare, thankfully. But if it's left untreated, especially in chronic or severe cases, you could end up with persistent pain, ongoing stiffness, and just difficulty using the finger properly, functional limitations.
So probably best to get it checked out sooner rather than later.
Definitely. Early intervention usually leads to better outcomes and avoids those potential long-term issues.
Okay, great. So wrapping up our deep dive here. Trigger finger, it's about that tendon and sheath, the size mismatch causing catching or locking. Risk factors include repetitive use, certain health conditions, age, gender. But the good news is diagnosis is usually straightforward, and treatments, from splints and injections to sometimes surgery, are generally very effective.
Exactly. A neat example of how a relatively small mechanical issue can cause noticeable problems, but thankfully it's usually very treatable. Hope that's been a useful overview for everyone listening.
Yeah, hope so too. And if you want to delve deeper into MSRA revision topics like this, remember to check out pastthemsra.com.
And for free resources, head over to freemsra.com.
Thanks for joining us on this deep dive.